Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy. Today, we're going to talk about how to release those nerves safely. Nerve flossing, that's a big thing that we do here at Rehab and Revive. A lot of this is given to our patients, and most likely you're our patient. Let's talk about the things that you're going to look out for. If you have issues doing nerve flossings, what you're going to end up feeling is that you get stiffer after every repetition. You're also having numbness or tingling. Now, how do you know you're doing this safely and correct? Well, we have our monitoring hand, which we're going to talk about next, as well as that things get looser and looser over the next 2, 3, 4, 5 reps.
Loosey-goosey, baby. Loosey-goosey.
So that's something big that we really want you to stress and make sure that you're doing safely. All right, so let's talk about how to set up this exercise. Ideally, you start lying on your back. Of course, you eventually can do this sitting, standing, once you have a good gauge of how to find that nerve tension. Remember, it's a stretch, it's a light stretch, it's a nerve stretch, it's not a deep stretch, so make sure you don't do that. What you want to do is you can find your nerves kind of in this nook here between your throat and this muscle here. You can throw your fingers here. This becomes your monitoring hand. Make sure that you understand this is where that is. Now, anywhere, especially those who have tight nerves, you can end up, it can push out into your hands. But that's not the only place you can feel nerve tension or nerve stretch. You can feel it in your fingers. A lot of people end up feeling in their index finger. You can feel it in your wrist, forearm, bicep, all the way through your collarbone into your chest or pec muscles. That's all possible. So whatever you feel first, it's like a light tug is what I tell people. That's all you need to do. Listen to your body. Less is more. So I'm gonna stress this out. Now I'm gonna stress this again. Less is more. So let's start. You wanna start like you're gonna go bowling, and then you're gonna move to a snow angel motion. So you're gonna go bowling, and then you're gonna go snow angel. Now that's if you have really good range and you don't have any issues. I'm just showing you quickly that's where we're headed. So what you want to do here is you throw that monitoring hand there. If you feel a tug, like I said, in your neck, in your throat, anywhere, then that's already it. You hold it for 5 seconds, no more than 5 seconds, and then you go back down. And then you can come back if you want, but some people can just leave it there. So again, so let's repeat that again. 5 seconds, and you can cock your wrist back and open your fingertips. A lot of people, if you're feeling it too much in your fingertips, then just relax the fingertips, but go through here and then back and then out and hold. Ideally, you're doing this about 15 repetitions and no more, and a couple sets you want to rest in between. Now, if you're doing this correctly, over time, you're going to feel it inch up without as much tension. And you may feel pulling going to different places, and it changes over time, and it changes every time you change angle too. So, let's go this way, cock your wrist, and then that's when I'm feeling tension. Right now, it moved over here, so if you want, you can move to the place that has the tension and then monitor that, because hopefully that changes. And yeah, there we go. And you want this ideally at the plane of your body. You don't need to throw it back too far. That puts a lot more tension. You can see something just freed up in my shoulder, and I can get all the way up, and that's the goal. Once you get really pretty good up here, then you return. And you may not get this all in one session to get it up here. Usually it takes about 3 weeks, so make sure you're monitoring this. Have a discussion with your physical therapist about this. And you want to bring that back down. You don't want to just quickly drop it, and then you go back to here. If you find yourself having nerve tension, numbness, tingling, or increased pain, the quick thing is, I call this the nerve protective position, is just go right into a mummy. And if you're feeling numbness, tingling, it should go away within a minute or two. So hopefully you got your nerves feeling looser and things are moving and the pain is starting to reduce. This is one of our favorite exercises. I always tell people this is a little bit of the poison of the snake that bit you. So definitely check in with us, check in with your healthcare professional if this exercise is starting to do the things I told you it shouldn't do. Numbness and tingling, getting tighter, heavier, stretch, and of course increased pain intensity. So make sure you don't have that. If you like what we're doing, please subscribe below, leave some likes, leave any comments as well. I'm Dr. Lin. Remember, we heal smarter, not harder.